Good morning. You can tell where we are, right? Because you needed to go into hospital after all yesterday, didn't you? Didn't you? Mm-hmm. Expected, to be perfectly honest. It was, yeah, when she starts fitting and throwing up like that, she ends up here. That's just what she does. It is just what she does, isn't it? Yeah. Yes, hi. Love you. Even though we're here, and even though we've had a shit night. Oh, I know, it was a shit night, wasn't it? Big deep sigh from Elin here. Right. What happened yesterday? Elin kept throwing up yesterday and she kept fitting yesterday. She didn't keep the clobazam down. Clobazam is one of her anti-epileptic medicines. It's the first step rescue we have for her. So that came up, and ondansetron, which is an antiemetic and should supposedly help with her vomiting. Well, that came up, didn't it? Didn't it? And all of the diarrhea that I was giving her, and I was giving her diarrhea very, very slowly, but I was trying to keep her hydrated at home. Well, that came up, and everything came up practically undigested. Like you can smell it, right? It did not smell of vomit. It smelled of exactly what I was putting in. So all of that came up, and then she started vomiting bile, and I was like, okay, right, we're heading into hospital. So I rang for open access, and I was speaking to somebody who is new here, who doesn't know Elin, and I said, she has open access for seizures and vomiting, and we need to come in. Okay, so how many times has she vomited today? And I went, about 40. 40? Yeah. 40? Yeah. How many seizures has she had? Well, they go hand in hand, so about 40. Oh my god. Okay, well, just ask any Sarah or Jenny, they know Elin. Hold the line. It's quiet for like a few seconds, and then she's back going, yeah, you can just come straight in. Yeah, we will do, thank you. But we did take our time. And now, because my mum and my stepdad are here, my mum was sitting with Elin and just making sure that she was okay whilst I packed. Despite that, I forgot to bring my phone, which my stepdad then brought down for me yesterday evening. Thank you. And I also left my toiletry bag at home, so I don't have a toothbrush, I don't have a deodorant. I'm feeling a little bit iffy, if I'm honest. Yeah. Elin is looking at me now going like, yeah, you stink, Mum. Mum, you smell. Mum, you smell. Is that what you're saying? You're such a rat bag. Yes, we came in, and it's been very much a case of hurry up and wait. They are busy, the ward is full, they have no spare beds. We have the HDU room, high dependency unit, of course, because this is Elin, and this is where she ends up. And then when she starts getting better, they'll probably move us out of here to make this room available for somebody who's more ill than she is. But right now, she's the priority for this room. And it took a long time to get anything happening, really. I brought her buccal midazolam with me to hospital and gave that as soon as we came in. And we got about 50 minutes on that one of her sleeping. And then she woke up, and then she was fitting again. And at this point, she's throwing up what's called coffee grounds, but it basically means that she's broken on the inside and she's throwing up blood. But it's old blood, but her vomit was very dark, almost black, just fluid, not anything solid in it, just fluid, but very dark, stained with blood. So this is not good. It's painful for her, it's uncomfortable. She's been having low level seizure activity, so her pulse hasn't been that high. At the moment it's 120, so I'm super happy, but it's been staying around 140, 150, which is really low for Elin when she's having seizures. But it's been staying there, and she's been vibrating overnight until we got some more buccal, and that took time as well. Getting a cannula in went unusually well, but it took a long time before the attempt happened. So we got the cannula in second attempt. Woohoo! However, have a look at this. That cannula has already failed. Can you see how swollen her little hand is? It's super, super, super swollen. which means that the fluids have been pumping into her hand rather than going into her veins. And I'm going to pause here because I've got a student nurse in the room. We discovered that the cannula had failed just as we were trying to give a bolus of extra fluid. So she's been on fluid maintenance overnight, but she's not had any urine output since yesterday afternoon. So they wanted to give her a boost. But yeah, at that point we discovered the cannula had failed, and this is a very swollen little hand, so I bet she's really uncomfortable. And this means that we can't give any medicines at the moment because we're still giving her stomach arrest because she's still throwing up a lot. And we need to find a consultant here who is really, really good at getting cannulas in because she's super difficult. And this is just reinforcing my thinking that she needs a portacath. She definitely needs a portacath. The student nurse who just came in, she just wanted to check if there was anything we needed, and I've asked for a 10-minute break. Because they're so busy at the moment, they have so many children on the ward. I am full on medical mama. So I've been on duty since we came in yesterday afternoon. Hardly any breaks. When she stops vomiting, then I'll be able to go to the toilet whenever I want to because she'll be fine, she'll be safe. But right now, she's not safe. Right now, she's throwing up, and that means that every vomit is an aspiration risk. And once we have aspiration pneumonia, we're really heading downhill. We don't want that. No, we don't like that. Can you see the rash on her face? This is because she's been throwing up stomach acid, so she's very raw. Hi, are we having a little seizure? Are we having a little seizure, darling? Yeah. Oh, and there. So this is what happens. She has the seizure, and then she immediately tries to throw up. There's nothing in her stomach, but she still finds something, so we got kind of foamy phlegm now. Ooh! Good girl, good cough. Good cough. Good cough. There you are, well done. Okay, so what about a portacath? Why do I think she needs one? And what do we need to think about? A portacath is a kind of cannula that stays in for a long time. We're talking several months up to 2 years. It's placed somewhere on the upper body, very often kind of near the armpit. It goes into central vessels, and then the port is covered by a latex cover so that it stays sterile. And that means that we have access to IV without having to cannulate her. We have access to blood tests. We are able to give her TPN, total parental nutrition, so that we don't make her nutritionally compromised, i.e. starving, whenever she's in hospital. And nil by mouth when her stomach does this. Okay, good girl. And also, if she needs to be sedated, she can be sedated using IV rather than gas, and it's the gas sedation that she responds to so badly. There are risks involved with the portacath, of course. There's infection risks, there's risks that it goes the wrong way, that it causes internal bleeding, that when it comes to replacing it, it has grown stuck in there, that you get lesions around it. These risks are fairly small, but they're definitely there as soon as you... Oh my god, that's a lot of seizure activity, girl. That's a lot of seizure activity. You know, if you put a foreign object inside a body, there are risks to it. But in my mind, the risks are outweighing... the benefits are outweighing the risks. Not the other way around. The benefits of it outweigh the risks now. This is not totally my own decision. I've read up on it. I've discussed it with a couple of anesthesiologists in the past. The doctor who cannulated her yesterday, she said straight up, this is a child who could really benefit from a port. Dad has not read up on it yet, but I've talked to him about it. But this is something that I really want him to look into as well. It isn't my decision, although I am going to be very reluctant to accept a no on it. But he needs to look into it and make up his own mind about it so that he's comfortable. But we're definitely heading down the route of a port. Yes. Yes. And they rang me from Stanmore Hospital today and wanted to book a pre-op appointment for Elin's right side. And I'm like, yeah, I don't want to do that yet. I'm sorry, but I just don't. I'm not ready to even think about operating on her right side until A, she's regained the weight she lost, which at the moment is not looking good, and B, I have a port. Because I'm not doing another big surgery on a gas GA. I don't wanna. No, I don't wanna, Elin. What else? The physiotherapist has been to see her, and at the moment she does not have aspiration pneumonia, which I knew, but she is holding her breath and she's being a bit silly. But I'm obviously trained in both her chest physio and any other physiotherapy needs that she has, so I need to do some physio on her leg and on her arms and just keep her moving. And right now I've got her sitting upright. She's still not very comfortable sleeping on her left, so she's spending a lot of time sleeping on her right, because obviously if I lay her down on her back at the moment and she vomits, that we're asking for trouble. And she can't lie on her front. Can you, my girl? No, you can't. No, you can't. Give me that. Good girl. Do you want your music back on? She's full of smiles though. She's very charming with all the doctors and the nurses. Hey, you a bit tired? You could do with a nap. I could do with a nap. Yeah. Oy, oy, oy. Just to hammer home the point that I could do with a nap. But yeah, that's where we're at the moment. So she's not super duper duper ill. She's not well enough to be at home. Issues around the cannula. Hurry up and wait. Yeah. And I will get back to you, obviously. Of course I will. On another update. So thank you for watching, and we'll see you again very soon. Bye.